Over the years, I often wish that I had a good checklist for when I open the face and the vessels look inadequate to place a gracilis into the face. So what I've tried to do here is just develop a handy list that will be useful for any gracilis surgeon who gets into that situation. There are 10 simple maxims. First maxim, calm down. It's a high flow flap and it is very likely to perfuse once you find an adequate arterial input and a venous output. Number 2, warm up the room. If you warm up the room, you get great vasodilation, and that's going to help perfusion and actually increase the vessel diameter. Number 3, you want to identify lifeboat vessels. You need to identify the superficial temporal artery and vein. You need to look for the external jugular. You can find the transverse vessels. You can even think about contralateral options. You can get a vein graft from the leg, so you've got adequate extenders if you need them. But once you identify lifeboat vessels, you're going to feel a lot more calm. The next 3 maxims, 4, 5, and 6, are designed to increase the blood pressure. First thing, a ton of crystalloid. If the person is cardiovascularly healthy, which often the gracilis recipient is, you can really push those fluids, and it does a lot to bring the blood pressure up without the need for pressors. Maxim number 5, use a little colloid. We often give a bag of albumin to increase that intravascular volume and help our vessel situation. The 6th one is to lighten the anesthesia. We often do this to degrees that actually scare the anesthesiologists, but we've never had a problem with somebody waking up during the case. Lighten that anesthesia, and it's going to help you with that blood pressure sort of non-pharmacologically. Maxim number 7, put the patient in Trendelenburg. Again, that's going to increase the intravascular volume of the head and neck vessels and give you that better diameter that you're looking for. Number 8, a little bit of topical lidocaine. 2% lidocaine, obviously without epinephrine, is going to create that vasodilation by relaxing and paralyzing the smooth muscle cells in the media. That's going to give you some help. Number 9, consider a little bit of propanolol for yourself. It'll stabilize you, and it's done wonders for me as a microsurgeon. Finally, bring the microscope in early. Get that microscope in there, do some proximal dissection. You are going to get to a point where the vessels get big enough that they're totally appropriate. And if you need a vein graft in that situation, it's fine. The last thing I'll say is another microsurgeon is such a great thing to seek when you're in that situation. If you have a person available to you who is also a microsurgeon, they don't even sometimes need to scrub in, but just having another set of eyes can really calm you down and help the situation out. Now, if you forget any of these things, we've put it into a jingle for you. That's an AI-generated little song called Surgical Rhythms. So we're going to make it available to you also on this Instagram, and hopefully that'll help you. Great luck.